and welcome to today's 411 as we observe World Heart Day. Today we have with us Dr. Ramroop, Dr. Shaun Ramroop, Senior Medical Officer with the Primary Health Division. Welcome, Dr. Ramroop.
Hi, good morning. Thank you.
Now we're here to talk about World Heart Day and all the issues associated with the heart and how, we as a community can lower our vulnerability to these diseases. So start us off by telling us a bit about the objective of World Heart Day.
Okay, so World Heart Day is commemorated every year to remind persons, communities, countries, and the world at large about the risks of cardiovascular disease. We may say it as CVD, cardiovascular. Cardiovascular meaning to do with the heart is cardio, and vascular means the blood vessels. So that's a simple way to think of it. It's a day that's used to increase awareness and to remind us as a people that it's the number one cause of death worldwide annually.
Yes.
This year, the motto is use heart to beat cardiovascular disease.
Okay.
Right?
So tell us a little bit about what cardiovascular disease is and what we should know about it to safeguard ourselves.
Right. So cardiovascular disease, as I started to speak about earlier, occurs when those blood vessels that go to the heart and the brain primarily are affected. What can affect them? High blood pressure, diabetes, high cholesterol. The disease process involves those blood vessels getting blocked. When they get blocked, you can have cutoff of blood supply either to your heart or your brain, and you could end up with a heart attack or a stroke. That's the simplest way to put it.
And what makes us vulnerable to cardiovascular diseases?
Right. So the main reasons for cardiovascular diseases are lifestyle changes. Diabetes and hypertension and high cholesterol are, in the most part, occurring because of changes in our lifestyles. Changes to diet, reduction in physical activity or exercise, cigarette smoking, tobacco smoking, and increased amount of cholesterol in our diet. And last but not least, improper use of alcohol.
Okay.
Those are the major risk factors.
And would you say cardiovascular disease is a problem here for us in the territory?
Definitely. We have information from NHI that between 5 and 10,000 persons here are treated annually for hypertension, which is a major risk factor for cardiovascular disease. So the problem here in the BVI, the primary problem is hypertension, high blood pressure.
Hypertension. Now, what are some of these diseases that affect us mostly? You said hypertension, but what other cardiovascular issues we are susceptible here?
Okay, so high blood pressure is one, elevated blood sugars, diabetes is another one.
Okay.
People who have high cholesterol, and specifically high bad cholesterol, that's the one that gets into the arteries and blocks up the arteries and can predispose you or put you at higher risk to get that stroke or to get that heart attack, right? In addition, in the territory here, we also have a lot of high prevalence of kidney disease. High blood pressure is a primary contributor to that. So those are some of the cardiovascular diseases you can get.
Now, if you mentioned earlier that a lot of the issues associated with cardiovascular disease is lifestyle. And it seems simple enough, right? To eat, to exercise, to stay away from smoking, to, drink moderately.
Right.
But why is it still such a problem, not only locally, but worldwide, if the issue is just lifestyle?
Good. So I want to make a point. So it is World Heart Day, and the WHO in 2016 actually embarked on a program called Global Hearts, HEARTS. Each of those letters have primary objectives. The WHO recognized that hypertension, specifically, to start with, was a major problem worldwide for a number of reasons. One, it's called a silent killer. You don't get any symptoms. Your first symptom with high blood pressure, unfortunately, could be a stroke, or could be a heart attack, or could be problems with your vision, or could be kidney problems. high blood pressure stays in the background. You may not get any symptoms and can cause you a whole world of problems with different organs in the body. So, the Global Hearts Program was initiated with 14 countries worldwide. What it's proposed to do is address those same things you spoke about. Why? Why is it such a problem? Well, the scope of the problem is so bad that 1.1 billion people worldwide have high blood pressure. And even though it's lifestyle, as you discussed, it sounds simple. Only 1 in 5 persons have their blood pressure under control. So in 2019, the British Virgin Islands, the Ministry of Health, gave an undertaking that the British Virgin Islands will be the next country, the next territory to join in the Hearts program. So we in primary healthcare, working together with the Ministry of Health, are in preparation to roll out in our health centers. It's a primary care initiative, a program from Global Hearts to try to help our people, the population, to reduce the effects of hypertension. There are a number of things we have to do. And the thing is, it always sounds so simple that, you change what you do, everybody knows what to do, but no. What we've been doing before, it's not been working. It's not specific to here, it's all over the world. And we have some specific initiatives that we're planning to roll out, hopefully very soon, that can assist us here in reducing the effects of hypertension in the BVI.
And I know for some time back we had rolled out an initiative, a chronic care model.
Yes.
How do you see that integrating and assisting persons in the management of their cardiovascular issues?
Right. So the Global Hearts Initiative for hypertension will be just one part of the chronic care model. There are other chronic diseases, non-communicable diseases, that are part of that model. So this would be the part that deals with hypertension specifically. So what we plan to do, there are a number of initiatives that have been shown, that have been demonstrated in studies all over the world, to increase the number of persons who have their blood pressure controlled. Right? The initial study for Global Hearts, I think 50% of the people, there was a 50% increase in persons whose blood pressure was better controlled. So people went from being uncontrolled to better control in a short space of time. Some of the things we have to do is, one, standardize how we treat it with medications and make life easy. One of the things people complain about all the time is that, listen, my blood pressure is high, I have to take 4 medications for the day, sometimes I forget. WHO is purporting that we should be using combination drugs, meaning that one pill taken once a day that can have 2 medications in it, even 3 medications in it. So it's just once a day dosing. So those are some of the things that we do with medication. We're also going to have specific instructions for persons and training for persons who have high blood pressure as to what you should eat, when you should eat it, how often you should eat it, and physical activity. There are specific guidelines for physical activity. For example, we always say that you should exercise more.
Yeah.
Simply saying that has not worked. What the WHO is now saying, the recommendation is, for healthy lifestyle, you need 150 minutes per week of moderate exercise. What that means is 2.5 hours per week. You can break it up however you want, but it's moderate exercise, so it's like a slow jog, fast walk. 150 minutes per week, 2.5 hours.
Per week?
Per week.
That seems reasonable.
Seems reasonable.
Yes.
Right? If you're into different types of exercise, you could cut that in half and make it high endurance, high intensity. For example, jogging, fast jogging, or people who go to spin class, 75 minutes per week is the same as the 150. So it all depends on how intense it is. If it's moderate, 150. If it's very intense, 75.
Okay.
Right? We're also going to have specific instructions. Some of the things, for example, we all know we eat too many processed foods, we eat too many sugary foods, too many sweetened drinks, and we don't drink enough water. That's pretty simple. But in addition to that, what we don't talk about is how much fruits and vegetables do you have for the day. For the day, an average size adult, that 70 kilogram person, should be having 400 grams. That's approximately 1 pound of fruits and vegetables for the day. Think about how many people have that. And as best as possible, unprocessed.
Unprocessed.
Yeah.
Dr. Ramroop, those things that you're mentioning is very doable.
Yeah.
When you look at, the impact that cardiovascular disease is having, not only locally but on a international level. You mentioned a combination of things for the treatment. You mentioned drugs, but you did also mention exercise and eating right. And how effective do you think once you do these things? I know for persons who already have some encounter with cardiovascular disease, do you think that it can be remedied alone with the proper diet and exercise, or is it automatically that they would have to be put on some kind of medication?
Well, that's a very good question. So what you need is monitoring. Part of our program that we're going to roll out to is going to enhance and intensify our monitoring process. So it depends. Some persons' blood pressure, studies have shown, can be controlled simply with diet and exercise. Now, the good thing about diet and exercise, if you have a proper diet and you exercise enough, intensely enough, you can lose weight. The best way to control your blood pressure is to aim to lose 10% of your body weight.
Okay.
Not in the short term, you can't do that in a couple of weeks, but if you do that in a couple of months, most people's blood pressure will be well controlled. Now, that being said, that doesn't mean that it's going to work for everybody. That's where the healthcare professionals come in. That's where our monitoring systems are important. So while you're doing all that, our staff in primary care will be monitoring you to see if you need more intervention, meaning medication. So it's really on a patient-to-patient basis.
Okay.
Some people, basically, there's a big family history, and they will become hypertensive or have high blood pressure, no matter what they do, and they will need to be on medications. That's just how it is.
As you just mentioned, primary health care and the vital role that plays in the management of chronic care. What type of services do we offer here at the BVI Health Services Authority that could assist persons, and when do you actually seek that primary care intervention?
Right, so that's a fantastic question. So what I will do first is talk about what individuals should do as their responsibility. Anybody who's over the age of 40 should have their blood pressure checked once a year. Once a year, at least. If you're at risk and you have a family history, you should start earlier. You should start while in your 30s. If you have any history of having problems with your kidney, having chest pain, shortness of breath, having anything to suggest a stroke, meaning weakness or numbness, sometimes we get these feelings of numbness or weakness of the face or weakness of the body, and it goes away. That can be a telltale sign that something is happening. If ever you have those, you need to go to your medical practitioner as soon as possible and get your blood pressure and so on checked and get examined. So if you're under the age of 40 and you have a family history, you should get it checked annually. If you have no family history of high blood pressure in you at all, get it checked once you hit the age of 40. So our services, all our health centers in the BVI, in the Health Services Authority, provide screening for high blood pressure. In addition, we do provide treatment and follow-up for persons with high blood pressure. Right? Our medications are available. We have very good medications available. Our physicians and our nurses are treating all the time. We have also recently had the services of a dietitian. Mostly she's based in Virgin Gorda, but we intend to use her throughout our health centers. So she's going to help in our program to get people to eat better. So what we plan to do in primary healthcare, in addition to the screening and the treatment that we provide now, we're going to have some staff retraining together with the Ministry of Health and PAHO to bring them straight up to the cutting edge. So the advice and the treatment that you get here in the BVI, in the Health Services Authority in primary care, should be the very same that you would get anywhere you go in the world with a developed healthcare system. So that's our aim in primary care.
Okay, and we also know that, the patients themselves play a vital role in their health. So how are you empowering patients to take control of their chronic disease, to aid in to helping them to get a better outcome?
Right, fantastic question. So what we intend to do is partner with NGOs, community-based organizations, and so on, to empower people, to let people know more about these diseases and how the effects can be mitigated. So patient empowerment through education, and we're going to provide them with simple tools. A simple thing, to teach someone properly how to check your blood pressure at home, how to take your medication, what to look out for, and to keep them in touch. We also hope to have more interaction with persons on a community level, right? And fixed interactions, better monitoring, and to provide that service. Sometimes what's happened, people need that psychological, psychosocial support from the healthcare providers.
Definitely.
And all those are parts of the HEARTS program that we intend to roll out very soon.
Now, Dr. Ramroop, I can't have you on the program unless we talk about, some of the common signs and symptoms of a heart attack and stroke. Talk to us a little bit about that. What's the difference between the two? And, how do we know if we're having one?
All right. So I'll start with heart attack. Now, as I said before, the term is pretty much explains itself. Cardiovascular means to do with the heart and to do with the blood vessels. If you cut a blood vessel in half, it's like a circle. What happens after time? You can get cholesterol being laid down inside it. It blocks up the area that the blood would normally flow through. And if the blockage becomes severe enough, the blood can clot there, block up the blood supply completely. And then whatever piece of tissue that blood was going to would die. So a heart attack is actually a piece of heart dying because the blood supply cut off. And a stroke is primarily the same thing. Now, there are different types of strokes. You can have the blood supply cut off because of a bleed in your brain, or you can have the blood supply cut off because of a clot. So, signs and symptoms of a heart attack, namely chest pain, also specifically jaw pain or neck pain. Going to the angle of your jaw, which is the corner here. If you have that, you need to get it checked out immediately. Some people only get shortness of breath. Some people just feel tired. Some types of heart attacks, people actually feel nauseated to vomit. So you have to be aware of all of them. A telltale sign, hopefully before you actually get a heart attack, is something we call angina. Angina is whereby the artery is blocked. Enough blood flows through all the time, so you're okay. But if you have to climb a flight of stairs and that piece of heart is pumping harder and it's working harder, the blood supply isn't enough, so you get some pains. But what happens is that when you get to the top of that stairs and you relax, the pain disappears. So that's even more important, because that can warn us, or that can warn the patient to say, listen, I need to get this checked out. So, there are a lot of hills here in Tortola. So if you're walking up a hill and you're getting chest pain or shortness of breath or that pain at the angle of the jaw, you need to get that checked out.
Wow.
Yeah, definitely. And of course, some of the other symptoms, we describe them as constitutional symptoms. Some people vomit, some people cold sweat, some people faint. Those are some non-specific symptoms that can go along with a heart attack. In terms of a stroke, as I said before, the disease process is basically the same. It's an artery that supplies a part of the brain, and if the artery becomes totally blocked, 100% blocked, that piece of the brain actually dies. And the symptoms you get depends on which piece of the brain it is, because different pieces of the brain are responsible for different functions. And some of the effects you can get are, one, people get weakness on one side of the body. They can get weakness on one side of the face. They can also lose sensation on one side of the body or one side of the face, or sometimes in one arm or one leg, right? Other symptoms, there are a lot of other symptoms with strokes. You may have problems coordinating how you walk and how you speak. And in terms of how you speak, it can affect how you speak to someone and your ability to understand someone talking to you. So those are the major things that can happen with a stroke or a heart attack.
Now, if you're in the process of having one, is there anything, and you're not in a medical institution, is there anything that you could do that would help to prolong your life before until you get to the hospital?
All right. In terms of that, the most important thing is to get help. That's the most important thing. If you are a known person with cardiovascular diseases and you have your medications, you can take the medications that you were supposed to if you had missed them. That's the only thing you can do, because we need to know exactly what's happening, and you need to go to an emergency room as soon as possible. Especially if you've never known to have anything before, you just need to get help and get to the emergency room for them to evaluate you as soon as possible. Because the actual treatment depends on what we find. We need to do tests and so on to confirm the diagnosis before you treat.
Well, wonderful interview here today with our Senior Medical Officer, Dr. Shaun Ramroop, here to talk about World Heart Day and a number of issues surrounding your heart and things that you can do to improve your heart health. Dr. Ramroop, I'll leave you with this opportunity to make any final thoughts.
Well, given that today is World Heart Day, I want to encourage everybody who's listening to remember the things I spoke about. Cardiovascular diseases are preventable in the most part. We need to do simple things. If you do not get enough exercise, you have to aim for 150 minutes per week. More fruits and vegetables. Some people speak in portions, some people speak in weight. I prefer to speak in weight. About a pound. Fruits and vegetables per day, or 5 portions. Ensure you drink enough water for the day. We live in a very hot climate and it's very, very humid. In addition, if you have high blood pressure, if you have high cholesterol, if you have diabetes, it is imperative that you take your medications. If you need to take your medications, you need to take your medications. They will prolong your life, not only will it reduce your deaths, it will reduce morbidity, meaning that the possibility of you getting sick will be reduced. And of course, we need to look at alcohol use, and we need to look at smoking, tobacco, right? Those things predispose you to having bad outcomes. I want to end by saying heart attacks and strokes, kidney disease, blindness, all these things are primarily preventable if we do take the right steps early on, right? So I want to remind everybody about that.
Wonderful, wonderful. Thank you again for tuning in to this edition of 411, where we had Dr. Shaun Ramroop here to talk about cardiovascular disease as we observe World Heart Day. Remember, lifestyle is a significant plays a significant role on whether or not you get cardiovascular disease, and we hope that the information that we brought to you today would help you or a family member in some way along the line. So if you like this video, share it with a friend, and continue to log on to our Facebook page and be educated on various things coming out from the BVI Health Services Authority. So once again, thank you for tuning in. Share this video, like this video, and have a wonderful day.